Welcome to ZAMBITION, the channel on which we engage in dialogue with leaders from across sectors and generations. For ZAMBITION, the term leader does not only refer to those in high-ranking positions. It includes everyone who is seeking to make a difference in society. Greetings and welcome to ZAMBITION. My name is Martin Kalungubanda, your host on this channel. Our guest today is Dr. Catherine Muyeba. She is a consultant psychiatrist with over 15 years of practice. Dr. Muyeba works with the largest addiction service provider in Europe and involved in the development of regional and national guidance. She is also a volunteer who offers her skills in teaching and training at Chainama Hospital, providing virtual teaching to postgraduate psychiatry trainees. Dr. Muyeba is a committee member of the Zambia Overseas Christian Fellowship, a UK charity supporting Zambians in the UK and beyond. She is also the founder of Reapers, that is, women who reflect, envision, action plan, review, and enjoy their lives. Dr. Muyeba, welcome to ZAMBITION.
Thank you very much. It's a real privilege to be here and to be chatting with you today. Thank you.
Wonderful. I would like to begin by inviting you to show an object or image that best describes the journey you have walked so far. What might that be?
My bullet journal. So the bullet journal is something which I've stumbled over a few years ago, maybe about 6 years ago. And since that time, I've been quite evangelical about it. And basically, it's a diary which has pages and a list of contents at the beginning where you can put information that is in the journal. Mm-hmm. And for me, journaling is extremely important because I not only record what is happening, it's very much what is going to happen. So as I envision, I document, and as those things come to pass, I write about them. With the bullet journal, I will write things like, people I would like to meet, books I would like to read, YouTube videos I would like to watch, and so on and so forth. How does it compare with other diaries? Well, other diaries, there's not enough space. There's just enough space for that day. Or if it's a normal, ordinary journal, they don't usually have the idea of the contents, the index at the beginning. But with the bullet journal, on a day that I want to write 4 pages or 10 pages, I can do that and then just move on to the next page. But at the index, I'm able to write what that title of that page is and which page. It's almost like I'm writing my own book, yeah. And I'm on the 4th one, so I try to do one a year, but as soon as it finishes, I get another one. And looking ahead, maybe in my 80s or beyond, it would be really good to read what has happened of what I've written forward. And along with that, it would be nice to give younger people to read the journey.
And imagine you were born and able to write in the journal. Where would that have started?
I think it would have started in my mid-teenage years, when I was maybe about 13 to 15. Mm-hmm. I am the second born of 6 children, the first girl. So I was very much part of like the leadership team in the home, helping look after my siblings, cooking for them and so on. And where I grew up, my parents were quite strict, so I wouldn't just go and play outside whenever I wanted. And I think in hindsight, that was good. So if I wasn't cooking or cleaning or studying, I would just sit and daydream. I literally was looking so far ahead. I literally saw the next 15 years of my life. So if I was journaling then, I would have been writing it down and drawing the things that I was daydreaming about, mixed with emotion, and literally living that life way before it happened. So that's where it would start.
And what would have been the 2 to 3 key moments between that age of 13, 15 and now?
Okay, I think the first moment would be, because like I said, 13 to 15 teenage years, I was at school and I loved science, I loved maths, I loved my studies. But at the same time, I think my teachers would say that I was quite playful. Maybe I didn't put in my full potential. When it came to grade 12, the final year, and with our form teacher, I remember Mrs. Peary, she told us, the motherly figure said, you know, apart from 4 of you, and she pointed the 4 people in our class, the rest of you should not choose natural sciences. You should not choose natural sciences. So I need to maybe backtrack a little bit. What were my dreams? My daydreaming was I saw myself as a doctor. I would wear a white coat, I would wear my high heels, I'd be seeing patients, looking after patients. I was a doctor. I lived like a doctor during my teenage years. So when she said that only 4 of you should pick natural sciences, and by the way, I wasn't one of the 4, I thought, I'll go to university then and study what? I hadn't seen anything else apart from being a doctor, and I needed to get into natural sciences. So I think that was one key thing which I can say. When she wasn't looking, I ticked natural sciences. And then as she was leaving with a pile of paper from everyone else, I ran after her and put mine at the bottom where she didn't have time to check. And that's how I got into natural sciences. The other key moment was as soon as I got there, because there was an expectation that maybe especially girls who had come from certain schools like where I went, you know, where they believed that we were spoon-fed. Most people tend to fail first year, especially natural sciences. So for me, I was determined that I was not going to fail. So the first person I met in my, who was now in second year, also on the path to medicine, I asked for all her books. So I was always a step ahead. I knew what was happening. I knew what I was doing and so on. And she was like my first mentor. And year after year, I took her books and was always a step ahead. And that definitely helped my medical school. And my second mentor being my husband now, he was in his final year of natural sciences. And when we met, he taught me how to study maths. And those kind of studying helped me set me up to do medicine. And I succeeded in each and every year without repeating a year and proving and showing the exact thing that I had seen in my dreams, yeah.
Wonderful, and a beautiful story for that matter. What I'm learning from you as I listen, one, it is just the importance of those we look up to as teachers, being mindful at what they say to us. Mm-hmm. You were the lucky one who didn't hear what your teacher thought was the case. Mm-hmm. And you found a way of ticking natural science. But imagine if you had let go that which was within your heart. Mm-hmm. And number 2, the need for us to identify good mentors. Yes. That second year student and the other one who was a few steps ahead, who later became your husband, to have good mentors in order to navigate our way to the future we want. Yeah. Dr. Muyeba, how did you decide to specialize in psychiatry?
I was going to be this doctor who looked after women. I loved women. I studied the biology of women. I knew everything about the female and so on. So as soon as I finished my medical career, that was what I was going to do. I was going to do obs and gynae and work with women. But in my 6th year, the year that we do psychiatry, when we went to Chainama, I just fell in love with the subject. I don't know what it is, but whereas maybe some people might have been frightened of talking to people, getting their history and doing examination, for me, I just gravitated to the individuals. I would sit on the floor and just talk to them whenever we were there. It just came naturally. And I remember the professor there telling me, have you considered becoming a psychiatrist? But like, oh, no, definitely not. And then we had another visiting Zambian psychiatrist who was based in the UK. So he came to visit while we were doing our exams. And he also said, have you considered doing psychiatry? You really must become a psychiatrist. And I think from the whole time I started doing medicine, it was one subject where I probably got the best grade because it just came naturally for me. But if I had stayed in Zambia, I don't think I would have done it because there was the stigma around it. And I remember even my dad saying, I have some medicine, say, and then I have a doctor, and to translate that, you go and do the whole course medicine in 7 years, and then you just become a doctor for people who are mentally unwell. But I did keep the things which the professor had told me. I kept it in my heart and left it at that. But I went into obs and gynae, did it for 6 months. I thought it wasn't for me. Definitely not. There were things which were happening which I didn't sit comfortably. And one of them being when you had to deliver complicated pregnancies, you met with traumatic experiences, and sometimes babies died, sometimes mothers died. I thought, no, it was too much for me. And I started thinking again, what else can I do? I thought, I will go and do general medicine, the biology, the physiology, how everything works. I thought, this is really good. And I did that again as the second job I did when I was at UTH. That was the time at the peak of the HIV pandemic. And it was really sad. You sort of stopped thinking, and everyone had AIDS, and all you were doing is giving them fluids. There was no cure at the time. So again, that was quite depressing for me. I thought, no, this is not the reason why I wanted to do medicine. So at that time, after those first 2 jobs, I joined my husband who was studying here. I took some time out to, get the babies stable. And when I went back to study, when I did the exam to practice in the UK, the first job I did was just a short job in surgery, just to help me get acclimatized with the British system. And during that time, the next job was going to be the job that I wanted to do. And I hadn't made up my mind, but then psychiatry started ringing again. I could go back, maybe let me try it. And the stigma was the same here, because the consultant that I was working with, the surgical consultant, was like, why do you want to do psychiatry? You're just going to waste your whole medical career. So because of that, I decided to take a time and worked in accident and emergency department, where you saw different kind of, departments and professions, different kind of patients. And during that time, it became very clear for me that psychiatry was my path, because everyone who came in with emotional problems, or maybe have taken an overdose, or they've self-harmed, or were very distressed, I just, again, naturally gravitated to those kind of patients. And I remember the team of doctors I was working with were like, when they get a case note, and they're like, oh, Catherine, another one for you, another one for you. So for me, that's when I decided. I didn't tell anybody. I just applied for the job, went for my interviews, met psychiatrists on the interview panel. They offered me the job, and that's when I started telling everyone else, and I've never looked back since.
Thank you, Dr. Muyeba, for explaining and sharing with us how you came to specialize in psychiatry. Allow me to ask this question. Where does the stigma of mental health challenges that we face come from? When you look at society, all of us are not only candidates to mental health challenges, but all of us at different times in our cycle of life do experience dips, lows, and highs. Some are slightly longer and need support such as you give. Where does the stigma come from, and how can we overcome that?
Yeah. And I think stigma is very much based on people's perceptions. When people perceive something in a negative light and then they reduce the value of that thing, then they look down on it and they, so they couldn't care less about it, so to speak. And there are different ways in which people, are stigmatized against, and mental health is one area where the stigma is immense. We have come a long way as a society, both in Zambia and here in the UK and the world over. People are talking more about mental illness in a positive light. And where does it come from? I think one person thinks something about the other and they share with somebody else and then share with somebody else, and then it goes on like that. If that's the way that it develops, equally, that's how we will overcome it, by talking about it and painting a much more positive light about the issues that people face when they have mental health problems. And one way, again, that we're going to overcome it is more people of influence talking about it. Because like you said, mental health problems can affect any one of us. And in my practice, I've seen people who, CEOs of large organizations, to people who are homeless and don't have anything to their name. Everyone can be affected by mental health problems or by addictions. And therefore, the more we talk about it, that this is common to everyone, the more we will reduce the stigma and get people to seek help as much as they need to.
Thank you. And now I would like to ask you a question around where you are based. You are a very highly qualified consultant psychiatrist with, as I introduced you, many invaluable years of experience. You are based in the United Kingdom. You are supporting many people in the UK. Do you feel guilty when you think about or hear about the situation, the needs back home in Zambia?
I have to admit that I do think about the situation in Zambia all the time. I do. And to help mitigate that, I have established good relationships with the psychiatrist in Zambia, and I'm in regular contact, and I'll do what I can whenever I can. Coming to the UK, I came to join my husband who was studying here, and we have ended up staying longer than we had anticipated. And there are various factors personal to us, factors maybe in Zambia and factors here. We've had our children, the children are in school and then they grow up. Sometimes it's never easy to know the best time to go back. And like I said, it is personal to us. For me, I live my life without regret. So when I get to a point where I decide that this is what I'm going to do, I don't make those kind of decisions lightly. I will look at the pros and cons of either decision. I will explore and get cross-reference with what the situation is like, what the society is like, what other people are doing, and learn as much as possible. But when I get to that point where the decision is made, then put in everything and make the best of that situation, rather than living with regret. And yes, I still feel there's a place when we will go back. I can't say the days and the times, but while I'm here, while I'm making the best of my current situation, I do not forget what I'm doing at home. And that's how come we came up with the idea of doing the virtual teaching. I meet up every week or fortnightly with 6 amazing upcoming psychiatrists in Zambia. I'm able to impact my skills and knowledge that I've developed here in them, and maybe in the future allow them to come and experience, maybe whether it's for 3 months or 6 months, whatever the case might be, allow them to come and experience what else is here. So being here not only creates opportunities just for me, but it also creates opportunities for home while I'm still here and home when I go back, and opens doors for other people to also experience the skills and knowledge that I've acquired here while they're there, but also if they were to come for a brief period and go back. So guilt, maybe a little bit, but live life with no regrets.
What a wonderful principle. Live life with no regrets. And as I was asking you that question, I realized how it has been made redundant by even the experience of the last 12 months living under COVID. I speak to you with the experience of myself teaching on the west coast of the United States from my home, on the east coast of the United States from my home, and I have had students in New Zealand and Australia all from my home. So all of us that are scattered in different parts of the world and still call Zambia our home, there is no excuse why we can't continue to contribute like you are doing at Chainama College of Health Sciences.
Yeah. And just to add as well, if you're registered in a country, registered in the Health Professionals Council of Zambia, you can contribute to managing cases as well. So that's another thing. I'm in the process of reactivating my registration and see what I can do to help add capacity to the number of psychiatrists in Zambia. And in particular, like the drugs and alcohol teams, setting up something like that. Yeah.
If I could put in a personal plea, the faster that can be, the better, because we need people who are going to help us strengthen our ability to overcome mental health challenges. They are much deeper. Even as a layperson, I know that they are much deeper than we often concede or accept.
That's right.
Dr. Muyeba, we'll take a little break. And when we return, I will ask you what your ZAMBITION is.
Thank you. Thank you for that.
Impact Hub Lusaka, a member of the Global Impact Hub Network, is transforming the way we learn and solve personal, organizational, and societal challenges. We do this in 3 key ways. We bring together entrepreneurs and the resources needed to activate and actualize intentions. Our process for learning enables entrepreneurs and organizations to activate their capacity for creativity and innovation. But most importantly, our physical space brings together emerging and aspiring entrepreneurs to learn together and share lessons on how to activate and transform their dreams into reality. As our name suggests, Impact Hub Lusaka, helping organizations and individuals to create impact.
Welcome back. My name is Martin Kalungubanda, your host on ZAMBITION, Dialogues for Our Common Future. And our guest today is Dr. Catherine Muyeba, a consultant psychiatrist. Dr. Muyeba, what is your ZAMBITION, your highest aspiration for our country?
For me, I think it's about seeing access to mental health services across the country. And I know it's a huge ambition, but it's about starting small. Like I said before, there are a number of psychiatrists in Zambia, but not as many as we would like, you know, and they are doing an incredible job, and they have really contributed immensely to, you know, raising the profile of our mental health services and increasing help seeking to people, the local community. One key thing which we're still working on is the access to drug and alcohol services. I've seen how the model works here, and I think there are parts of that model that would work beautifully in our country. There are local community clinics, you know, like Mtendere, Kalingalinga, Chawama, and so on. So having hubs in there of community alcohol and drug services with people trained, and they don't have to be fully fledged professionals. The model of traditional birth attendants worked really well in reducing maternal child health, maternal death during deliveries. And similarly, if we trained people in the community to raise awareness about identification of drug and alcohol problems and, you know, simple brief intervention advice at that local level. And where the complications arise or somebody is identified as having problems, they refer them to, professionals like a Chainama clinic. So that is my ambition, to help set that up, one clinic at a time, and expand across the nation.
What might stand in the way of that ambition?
I think obviously resources is a big thing, resources. But like I was saying, because we're not looking at training fully fledged professionals right from the word-go, we're starting with people in the local community to become, maybe like what we would call support workers, or even just peer mentors, people with the lived experience, helping set those clinics up and helping identify people like that. What else might stand in the way? Obviously, they might increase the number of people having to access Chainama, but it's again raising the capacity, training more people to identify and treat those common mental disorders, and setting up, allowing the alcohol detox center at the Chainama Hills Hospital, the detox center, to be fully functional and open, so that people are going in and coming out and building that recovery community and increasing that in their communities. Yeah.
I have never tried to understand the origin of the name of the center in Lusaka. Do you think the name Chainama comes with a baggage, that it has now been a personification or the manifestation of all the stigma we have? Because we do even use terms such as he, she is a Chainama case. Shouldn't we be thinking about changing the name of that institution?
I'm not fully clear where the name comes from, but regardless of the name, it would still carry that if people know that this is what they do at that place. At UTH, I think it's Clinic 6. So, she's going to Clinic 6. So it's like that. I know I've done some studies here because it's a similar case here. Oh, is at that unit. Oh, she's at that unit. Even people who are going for an outpatient appointment. But some of the studies I've read is that if a clinic is situated in other clinics, maybe there's a diabetic clinic here, a heart clinic here, a hypertension clinic here, and a mental health clinic there, and everyone is in the same waiting room, the studies show that people are more likely to attend services if it was at such a center. And that's why I think, the clinics, the local clinics, the veterinary clinics, they have one communal waiting room, and people are going into different rooms to see mental health professionals. I think that's where everything should be starting from, and equipping and making sure that they're almost like little mini hospitals, have everything that they need in those centers. Yes, Chainama is there, and Chainama does a lot of other things as well, alongside with mental health conditions. But changing the name without changing of attitudes probably will just shift the stigma from the one name to another. So it's alongside the shifting people's perceptions and attitudes, it's also trying to shift mindset rather than just changing the name.
Changing attitudes of ourselves, our people, our children towards mental health is at the core of what it will take for us to begin to tackle the problem as a whole.
That's right, yeah.
And my final question, Dr. Muyeba, is what is the best piece of advice you have ever been given?
I think the best piece of advice I've been given is about not giving up. Don't give up. I remember back again in the journey when I came into this country, and I tried to take the exam here to practice medicine, and I didn't succeed. The first time I was like, oh, everything is just racist. People don't want Black people to work here. And I was also surrounded by other people who believed that view. So I decided I'm not going to bother. I'll wait for my husband to finish his PhD, and I'll go back to Zambia and continue my practicing journey. But while I was waiting for my husband to do his studies, I met this lady, one of the doctors who was working in an A&E department, where I started doing some part-time work in there. And then she sat me down one day, like, so tell me about you. I heard that you are a doctor and you're here just taking people's bloods and doing investigations. Why can't you work as a doctor? So I explained to her, about this exam and so on. So she said, never ever give up. You can't pass that exam. Come on, you go and take that exam and pass it. And that strengthened my resolve. Like, yes, she was right. I can do this. And the moment I decided that I was going to do it, I shut my ears to everyone else who was saying, oh no, people here are racist, they don't want Black people to. I just shut those ears. And surprise, surprise, I did pass my exam. And since then, if it's something that has been done by somebody else, then I too can do it. And that's what I tell others, especially young people. I encourage them to dream. Dream, because when you dream and you have seen something in the future, then it's less likely that somebody will come alongside and send you another way, because you have seen something. If they brought other options, say, but it doesn't tie in with what I have seen, and then you're less likely to give up because you are dreaming. So that's what I advise. The advice I got, I give to others as well, not to give up. If you dropped out of first year at university, you can still go back. If you didn't write your final exam or failed it, you can still write it again. So don't give up.
Wonderful. Never give up.
Mm-hmm.
And here we are now, you specializing in a subject that the world needs so much, psychiatry. All of us are candidates to mental health challenges. We may suffer them in different degrees, but none of us is immune.
That's right.
Thank you very much, Dr. Muyeba, for your time and for your continued connection with Zambia, for your continued support of students in the university who are seeking to follow your footsteps. Thank you.
Thank you very much. It's been a great opportunity, and I hope everyone picks up an idea or two about moving forward. Thank you.
Thank you very much. Having listened to the dialogue and followed my conversation with our guest, I now invite you to look at the drawing that emerged out of that dialogue. Take time to see the contours, the colors, the images that are reflected on the painting, on the drawing. And pay attention to what the drawing evokes in you. What are the feelings? What are the thoughts that are ignited by you looking at the painting? What thoughts does the painting generate in you with regard to your own leadership? What thoughts, feelings, and images does this painting evoke in you with regard to the future of our country? What else does this painting make you think and feel? Kindly share your reflections on this channel so that we can continue the dialogue on the future of the country we all love, on the future of our nation.